If you are over 60 and take medicines for cold, pain, acidity, focus, swelling, or hormones, this video could be very important for you. Many people think danger only comes from junk food, smoking, or high cholesterol. But sometimes a medicine sitting quietly in your cabinet can put extra pressure on your heart. The scary part is that many people take these pills casually, without asking if they are safe for their age. This does not mean every medicine is bad. Medicines save lives when used correctly. But after 60, the body changes, the kidneys slow down, blood pressure becomes sensitive, and the heart may not tolerate stress the same way. A pill that felt harmless at 35 may affect you differently at 65. I am Dr. Jeffrey. Today we will talk about 6 common medication groups that may increase heart-related risk in some seniors. These medicines are often used for everyday problems like blocked nose, body pain, acidity, low energy, inflammation, or hormone imbalance. Some are over-the-counter, which makes people believe they are completely safe. But available without prescription does not always mean safe for everyone. Before we continue, remember this clearly. Do not stop any prescribed medicine on your own. Stopping suddenly can be dangerous. This video is for awareness, not personal medical advice. Your doctor knows your history, reports, age, blood pressure, kidney function, and heart condition. The goal is simple. After watching this, you should be able to ask your doctor better questions. You should know which medicines need caution, which ones should not be taken casually, and when a safer option may be available. One smart question can prevent a serious problem. So take notes, especially if you are over 60 or caring for someone older. Check your medicine drawer after this video. You may find something that looks ordinary but deserves a second look. Let's begin with the first hidden risk. The first group is decongestants, the medicines people take when their nose is blocked. You may have used them during cold, flu, allergy, or sinus congestion. These medicines can make breathing feel easier for a short time. That quick relief is exactly why many people keep using them again and again. But some decongestants can tighten blood vessels. They do not only act inside the nose, they may also affect blood vessels in the rest of the body. When blood vessels tighten, and the heart may need to pump harder. For a young, healthy person, this may not feel like a big issue, but for someone over 60, especially with high blood pressure, heart disease, irregular heartbeat, or blocked arteries, this extra stress can matter. The heart may already be working harder than it should. A decongestant may add another burden at the wrong time. This is why seniors should be careful with cold medicines that contain ingredients like pseudoephedrine or similar stimulants. Many combination cold medicines have several ingredients in one bottle or tablet. People often take them without reading the label. That is where the risk begins. A blocked nose feels uncomfortable. Is usually not worth risking high blood pressure or heart strain. Safer options may include saline spray, steam, hydration, humidifier use, or doctor-approved allergy medicine. But even these should be chosen carefully if you already have health problems. So before taking any cold medicine, especially after 60, check the label and ask your pharmacist or doctor. Tell them clearly if you have blood pressure, heart disease, diabetes, kidney disease, or thyroid problems. A simple cold should not become a heart emergency. The second risky group is pain relief anti-inflammatory medicines, often called NSAIDs. Many people take them for back pain, knee pain, headache, arthritis, swelling, or body ache. Because they are so common, people often treat them like harmless daily tablets. But for seniors, regular or high-dose use can be risky. NSAIDs may affect blood pressure, kidneys, fluid balance, and clotting tendency. When the body holds extra fluid, the heart has to work harder. When blood pressure rises, the arteries face more force. When kidneys are stressed, the entire circulation system can become unstable. This does not mean one tablet will harm everyone. The danger usually increases with frequent use, high doses, long-term use, or using them when you already have heart disease. Seniors who have had a heart attack, stroke, heart failure, kidney disease, or uncontrolled blood pressure must be extra careful. Many people make another mistake. They take pain medicine along with cold medicine, blood pressure medicine, or blood thinner without asking anyone. This can create unwanted interactions. Sometimes the heart risk does not come from one medicine alone, but from the combination. Pain should not be ignored, but it should be managed wisely. Your doctor may suggest safer pain control methods depending on your condition. Sometimes physical therapy, heat therapy, topical gels, stretching, weight management, or different pain medicines may be better choices. So if you take pain tablets regularly, do not panic, but do not ignore it either. Make a list of what you take and how often. Then ask your doctor, is this safe for my heart and kidneys at my age? That one question can protect you from silent damage. The third group is stomach acid medicines called proton pump inhibitors, also known as PPIs. Common examples include medicines used for acidity, reflux, heartburn, gastritis, or ulcer protection. Many seniors take them daily for months or years. Some people even take them like a routine morning vitamin. These medicines can be very useful when truly needed. They can protect the stomach in certain conditions and help heal acid-related problems. But the problem begins when people continue them endlessly without review. Long-term use should always be monitored by a doctor. Some research has raised concerns about long-term PPI use and possible effects on blood vessels, minerals, kidneys, bones, and overall health. Not every person will face these issues. But after 60, long-term medication use should never be automatic. It should be checked from time to time. Many seniors start acid medicine during one temporary problem, then continue it for years. They forget why it was started. The doctor changes, the prescription continues, and nobody asks whether it is still needed. This is how a short-term medicine becomes a lifelong habit. If you take an acid blocker daily, ask your doctor whether you still need it. Also ask if the dose can be reduced, taken only when needed, or replaced with lifestyle changes. Smaller meals, avoiding late-night eating, reducing spicy triggers, limiting alcohol, and weight control may help some people. Do not stop suddenly without advice, because acidity can rebound in some cases. The safe step is review, not fear. The medicine may still be necessary for you, but it should be necessary for a reason, not just because it has been in your drawer for years. The fourth group is stimulant medicines used for focus, ADHD, alertness, or sometimes weight loss. These medicines can increase activity in the nervous system. They may make a person feel more awake, focused, energetic, or mentally sharp, but the heart may also feel that stimulation. Stimulants can increase heart rate and blood pressure in some people. For seniors, this needs careful monitoring. A faster heartbeat may not be safe for someone with rhythm problems, blocked arteries, high blood pressure, anxiety, or past cardiac events. What feels like energy may actually be strain. The bigger concern is casual use. Some adults take stimulants without proper evaluation, sometimes to work longer, lose weight, or fight fatigue. But fatigue after 60 may come from sleep problems, anemia, thyroid disease, depression, vitamin deficiency, heart disease, or poor fitness. Masking it with stimulants may hide the real cause. Supplements can be even more confusing. Some products claim to be natural, but natural does not always mean safe. Certain supplements may contain stimulant-like ingredients that affect pulse, blood pressure, or sleep. Seniors should be careful with anything promising fast energy or rapid fat loss before taking any focus. Pre-workout or weight loss supplement. Talk to a qualified doctor. Ask whether your heart should be checked first. Ask whether blood pressure and pulse should be monitored. Ask whether the benefit is truly worth the risk. Your heart does not care whether a stimulant came from a prescription bottle or a natural supplement label. If it pushes your system too hard, the body reacts. After 60, energy should be built safely, not forced suddenly. The fifth group is corticosteroids, such as prednisone tablets or steroid injections. These medicines can reduce inflammation quickly. People receive them for joint pain, asthma flare-ups, skin problems, autoimmune conditions, allergies, or severe swelling. The relief can feel dramatic. But steroids can also affect blood sugar, blood pressure, fluid retention, cholesterol, mood, sleep, and immune response. In people over 60, these changes can be more serious. If someone already has diabetes, hypertension, heart disease, or kidney problems, steroid use needs careful planning. Many people think injections are completely local and harmless. They may say, "It was just one shot in my knee or shoulder." But depending on the steroid and dose, some effects can still spread through the body. That is why repeated injections or frequent steroid courses should not be taken lightly. Short-term steroid use can be necessary and even life-saving in some cases. The issue is not that steroids are always bad. The issue is using them without monitoring, repeating them too often, or taking them longer than needed. In medicine, dose and duration matter. If your doctor prescribes steroids, ask about your blood pressure, blood sugar, stomach protection, bone health, and heart risk. Also ask how long you need to take them and whether the dose will be reduced gradually. Never stop long-term steroids suddenly without medical guidance. Steroids can calm inflammation, but they can also disturb the body's balance. Used wisely, they help. Used carelessly, they can create new problems. Seniors should respect them, not fear them blindly. The sixth group is testosterone and hormone treatments, especially when used without proper testing. Many men over 50 are attracted to testosterone because they hear it may improve energy, muscle, mood, and libido. Some clinics market it like an anti-aging shortcut. But hormones are powerful, not cosmetic. Testosterone therapy may be appropriate for selected people with confirmed deficiency and symptoms, but it should involve proper blood tests, medical history, prostate evaluation, heart risk review, and regular monitoring. Taking it just because energy is low can be risky. One concern is that testosterone can increase red blood cell levels in some people. When blood becomes thicker, circulation may be affected. In someone with heart disease, clotting risk, sleep apnea, high blood pressure, or past stroke, this needs serious attention. Hormone pellets, injections, gels, or so-called anti-aging treatments should never be started casually. The method may differ, but the body still absorbs hormones. Feeling better for a few weeks does not automatically mean the treatment is safe long-term. Women also need caution with hormone-related treatments, especially if there is a history of cancer, clotting problems, heart disease, or other serious conditions. Hormones should be personalized, not sold as a trend. A good doctor will monitor benefits and risks, not just promise youth. So if you or someone you know is considering testosterone or hormone therapy, slow down, get proper testing. Ask about heart risk. Ask about blood thickness monitoring. Real medical care is not about quick energy, it is about safe, long-term health. Now let's pause and understand the bigger pattern. These 6 medicine groups are different, but they can create similar pressure on the body. Some may raise blood pressure. Some may increase fluid retention. Some may affect clotting. Some may make the heart beat faster. For a senior with healthy arteries, the body may tolerate small changes. But many people over 60 already have hidden plaque, high blood pressure, diabetes, kidney weakness, or inflammation. They may not feel these problems every day, but the risk can still be building quietly. A medicine becomes more dangerous when it is combined with other risks. For example, painkillers plus high blood pressure can be risky. Decongestants plus heart rhythm issues can be risky. Steroids plus diabetes can be risky. Testosterone plus thick blood can be risky. This is why seniors should not copy medicines from friends, neighbors, relatives, or online videos. What helped one person may hurt another. Your body has its own history. Your medicine plan should match your reports, not someone else's experience. Also remember that risk does not always announce itself. A person may feel fine until blood pressure spikes, chest pressure appears, breathing becomes difficult, or weakness suddenly develops. Prevention is easier than emergency treatment. The smartest habit is a medication review. Once or twice a year, take all your medicines, supplements, vitamins, and over-the-counter pills to your doctor or pharmacist. Ask what is still needed, what can interact, and what may be safer. Many seniors make one dangerous mistake. They only tell doctors about prescription medicines. They forget to mention pain tablets, cold syrups, herbal supplements, sleeping pills, digestive tablets, and energy boosters. But these can matter just as much. Your doctor cannot protect you from a medicine they do not know you are taking. Even a simple tablet from the pharmacy can interact with blood pressure medicine. Make a written list of everything you take, medicine or heart the name, medicine, dose, silence timing, creates and risk. Reason. Also write how often you take it. Only sometimes still matters if sometimes means every week or every time pain appears. If you use supplements, include them too. Many people think supplements are not medicines, but supplements can affect blood pressure, bleeding risk, sleep, liver function, and heart rhythm. The label may look natural, but your body still processes it chemically. When you meet your doctor, ask direct questions. Say, is anything on this list risky for my heart? Can any of these raise my blood pressure? Do any of these affect my kidneys? Is there anything I should avoid mixing? This kind of conversation makes you an active partner in your health. You are not challenging the doctor. You are helping them help you. Good doctors appreciate patients who bring complete information. Now let's talk about warning signs you should never ignore. If you feel chest pressure, heaviness, tightness, or pain spreading to the arm, jaw, back, or shoulder, take it seriously. Do not wait to see if it passes. Heart symptoms can be subtle, especially in seniors. Shortness of breath, sudden sweating, nausea, dizziness, extreme weakness, or unusual fatigue can also be warning signs. Some people do not feel classic chest pain. They simply feel not right. That feeling deserves attention. If symptoms appear after taking a new medicine, increasing a dose, or combining medicines, tell the doctor immediately. Mention exactly what you took and when. Timing can help doctors understand what may have contributed. Do not drive yourself to the hospital during serious symptoms. Call emergency help or ask someone to take you. Minutes matter during a heart event. Waiting at home can be dangerous. Also, do not try to balance symptoms with more pills. For example, do not take extra painkillers for chest discomfort or extra cold medicine for breathing discomfort. Treating the wrong problem can delay real care. This video is not meant to create panic. It is meant to create awareness. Panic makes people stop medicines suddenly. Awareness makes people ask the right questions early. So what should you do if you are currently taking one of these medicines? First, stay calm. Do not throw anything away immediately. Do not stop prescriptions without guidance. Instead, prepare for a smart medication review. Second, write down why you started the medicine. Was it for a cold, acidity, pain, inflammation, energy, hormones, or long-term disease? If you do not remember the reason, that is already a sign you should review it. Third, check how long you have been taking it. Some medicines are meant for a few days, some are meant for weeks, some are meant for years. The problem begins when short-term medicines become permanent without discussion. Fourth, check your risk factors. Do you have high blood pressure, diabetes, kidney disease, heart disease, past stroke, high cholesterol, smoking history, obesity, or sleep apnea? These conditions can change how safe a medicine is for you. Fifth, ask about safer alternatives. Sometimes the answer is a different medicine. Sometimes it is a lower dose. Sometimes it is lifestyle change. Sometimes it is monitoring blood tests. The goal is not to remove all medicine, it is to use medicine wisely. Finally, keep one rule. Never self-medicate repeatedly after 60. Occasional use may still need caution, especially if you already take heart medicines. Your heart deserves careful decisions, not guesswork. Let's make this practical with examples. If your nose is blocked, do not automatically grab a strong decongestant. First try saline rinse, steam, fluids, or doctor-approved allergy treatment. If you have blood pressure or heart disease, ask before using stimulant-type cold medicine. If your knee or back hurts, do not take anti-inflammatory tablets every day without a plan. Pain may need diagnosis. Long-term pain control should protect your stomach, kidneys, blood pressure, and heart. Quick relief should not create long-term damage. If acidity keeps coming back, do not simply stay on acid medicine forever without review. Ask what is causing the reflux. Late meals, obesity, alcohol, smoking, spicy triggers, and certain medicines can worsen it. Treating the cause may reduce dependence. If you feel tired, do not jump to stimulants or hormone therapy. Fatigue may come from poor sleep, low vitamin levels, anemia, thyroid issues, depression, dehydration, or heart problems. Testing is smarter than guessing. If inflammation keeps returning, do not depend on repeated steroid shots without understanding why. Ask about physical therapy, exercise, weight loss, posture correction, disease control, or other long-term solutions. Steroids should be tools, not habits. And if someone offers testosterone as an anti-aging miracle, be careful. Real hormone treatment starts with diagnosis and monitoring. A clinic that promises youth without proper testing is not protecting you. The most important message is this: medicines are not enemies. Misuse is the enemy. A medicine can save one person and harm another depending on dose, age, disease, and monitoring. That is why personalized advice matters. Many seniors suffer because they believe two opposite myths. One myth says, all medicines are dangerous. The other says, if a doctor once prescribed it, I can take it forever. Both are wrong. The truth is in regular review. Your body at 60, 70, or 80 is not the same as it was at 30. Kidney function may decline. Blood vessels may stiffen. The liver may process drugs differently. Muscle mass changes. Water balance changes. All of this affects medicine safety. This is why the same dose can feel stronger with age. Side effects can appear. Later, interactions can become more serious. A medicine list that was safe 5 years ago may need adjustment today. A yearly medication check is not a small thing. It can prevent falls, confusion, bleeding, kidney injury, blood pressure problems, and heart strain. It is one of the simplest ways to protect seniors. So do not wait for a crisis. Take action while you feel stable. Prevention is quiet, but it is powerful. Now here is a simple checklist for your next doctor visit. Number 1. Bring every medicine bottle, not just prescriptions. Number 2. Include supplements, herbal products, vitamins, pain pills, cold medicines, sleep aids, and stomach medicines. Number 3. Mention how often you actually take them. Number 4. Ask which medicines are essential and which are optional. Number 5. Ask whether any medicine can raise blood pressure, affect kidneys, increase bleeding, cause dizziness, or stress the heart. Number 6. Ask whether any dose should change because of your age. Number 7. Ask if blood tests are needed. Some medicines require kidney tests, liver tests, blood counts, cholesterol checks, sugar checks, or hormone levels. Monitoring is not extra, it is protection. Number 8. Ask what warning signs should make you stop and call the doctor. Every patient should know what symptoms are normal and what symptoms are dangerous. Clear instructions reduce panic. Number 9. Use one pharmacy when possible. Pharmacists can catch interactions if they see your complete medicine history. Buying from many places can hide the full picture. Number 10. Keep an updated medicine list in your phone or wallet. In an emergency, this list can help doctors treat you faster and safer. Let's recap the 6 medicine groups that deserve extra caution after 60. Decongestants, anti-inflammatory pain medicines, long-term acid blockers, stimulants, corticosteroids, and hormone treatments like testosterone when used without proper monitoring. These medicines are not automatically bad, but they should not be used carelessly. The heart does not fail only because of one big mistake. Sometimes risk builds through small daily habits. A cold pill here, a pain tablet there, an acid pill every morning, a supplement for energy. a steroid shot for pain, and suddenly the body is under more pressure than you realize. Your next step is not fear. Your next step is review. Look at your medicine cabinet. Write down what you take. Ask your doctor, do I still need this? Is this safe for my heart? Is there a safer option for my age? And please remember, never stop heart medicine, blood pressure medicine, diabetes medicine, steroid medicine, or hormone treatment suddenly without medical advice. Safe changes should be planned. Sudden changes can create new dangers. If this information helped you, share it with someone over 60. Many people are taking medicines daily without knowing what questions to ask. Your share may help someone avoid a serious mistake. For more senior health education, stay connected. Your heart works for you every second of your life. It deserves respect, protection, and smarter choices every single day.